Hi, this is Brian Heaberlin with Lexington ENT and Allergy, and I want to discuss what you can do at home to help manage your allergy symptoms. And so, allergic rhinitis and allergic conjunctivitis are a couple things we deal with here at Lexington ENT and Allergy. And a lot of these things can be managed at home without the need for, a doctor at all. And so, there are a lot of great medications that are available over the counter that you can take. You can manage these things without medication sometimes. And so, how do you do that? Well, one thing you can do is try to avoid the things that bother you. So if you know that you're obviously allergic to pets, avoiding pets might help that. If you know you're allergic to outdoor things, well, staying inside during the time when the pollen count or the things that bother you most are out can help that as well. And so allergy testing can help you figure out what you're really allergic to, but you can many times tell by when you're very symptomatic, looking at your phone or at one of these weather or pollen apps that'll tell you what kind of pollens are out at that time. Typically, trees bloom in the early spring in Lexington, South Carolina, where I'm at. That's usually around February. And then grasses hit shortly thereafter, so the grasses are usually more towards the summer months. They also start pretty early here, so usually late February, March. But in the northern states, it's going to be later than that. And then weeds typically hit towards the fall of the year. And so ragweed and other things like that may hit more so in August or September. And then typically after a heavy frost, that kind of kills the weeds and all the pollen, and then you don't really have that happen again until the next spring rolls around. But then there are the perennial allergens. And what do we mean by that? We mean the things that never really go away, such as indoor allergens. Dust mites are the biggest one of those probably. But molds can affect people all year round. Pet dander, if you have pets, can affect you all year round. So those perennial allergens, it's hard to sort of tell what you're allergic to because you're always getting exposed to those things. And so those can sometimes be worse during the winter months when you're maybe indoors more, you have the windows closed and things sealed up. Besides environmental controls, what else can you do? Well, there's a lot of great medications that are out nowadays. There are antihistamines. There were the earlier ones like Benadryl, we call those first generation antihistamines. And then there's second generation antihistamines like Zyrtec, Claritin, Allegra. The generic equivalents to those are of course fine. I like Zyrtec 10 milligrams daily. Allegra 180 milligrams daily, or fexofenadine is the other name for that, are also, those are great choices. And once daily, those will usually control a lot of the symptoms for nearly a 24-hour period. There are topical antihistamine nasal sprays like Astapro that's out, which can kind of help in the same way that the Zyrtec helps, but more in a topical fashion in the nose and can further help with some congestion and drainage. Nasal steroid sprays, and there are a lot of those that are out on the market that are excellent. Fluticasone or Flonase is the one we usually recommend, but there's also Nasonex, Rhinocort, Nasacort, lots of great options on those. And those are very effective. Now those take a little while to kick in, so it may take a week or two of regular use of those nasal sprays to really see the benefits from them. Sometimes those nasal sprays can cause some nosebleeds in some people that are susceptible to that, but usually they don't have hardly any side effects from them at all. And then there are some topical eye drops that can be used for some of the eye symptoms like itchy, watery, or burning eyes. Pataday is an excellent one that's out. And so those are probably the main things that you have at your disposal from a medical management side. I think certainly the second generation antihistamines and the topical nasal steroid sprays are the first things that you should try, adding in a topical antihistamine drop for your eyes, or a nasal spray probably is the second line things that could be done. So if you are doing those things and it's controlling things well and you're happy and satisfied with that, you don't need me. But if you're not satisfied with that and that's not getting the job done, you can come see us here at Lexington ENT and Allergy. We do allergy testing, we do immunotherapy, which are allergy shots for people. So there's lots of things we can do beyond what you can do at home, but most people are able to be managed at home quite well. Thank you. Hope it helps. We're here. We can help you in any way.